All right, Vivalifers, this is Dr. Kelly Omdy. We are back for another wonderful episode of Ask Dr. Kelly Omdy, and we are here with our repeat guest, Dr. Marsha. She is a reproductive endocrinologist and vitro fertilization specialist who is going to give us some down and dirty about IVF and egg harvesting. Dr. Marsha, you want to tell us a little bit more about yourself, and then you can go ahead and get started.
Okay, thank you so much, Dr. Kellyo, and welcome everyone. So my name is Dr. Marsha Baker. I am a double board certified fertility specialist. What that means, just like Dr. Kellyo, I'm a trained OBGYN. I also decided to pursue 3 additional years of training in reproductive endocrinology and infertility in order to become an infertility specialist. So my main area of practice now is really focused on helping patients grow their families, preserve their fertility, and really treating underlying hormonal issues. So I am so very happy that Dr. Kellyo invited me today so we can discuss this very important topic of, being intentional about your fertility, freezing eggs, and pursuing advanced fertility treatment. So just to get started, so much of fertility care tends to be very reactive. So many patients, when they come to me, it's after having tried for many years or after an event that has occurred medically that has made them really think about their fertility. So it's so great to be having this conversation because now we get to be proactive and talk about taking control of our fertility. So we're going to talk briefly about egg freezing, what's involved in the egg freezing process and preserving your fertility as it is right now. So first off, what is egg freezing? So egg freezing is a multi-step medical process whereby eggs are extracted directly from the female body, and then they're brought into a laboratory environment where they are frozen indefinitely until a future time when a patient's ready to utilize them to expand their family. So one of the main questions that many patients will ask is, well, why freeze my eggs? Why do it? So one of the things that's really important is to consider, again, about being intentional. The reason for patients freezing their eggs electively is to really take control of their future fertility. So we know that many women are delaying childbearing, either due to career aspirations, and sometimes because they just haven't found the right life partner. So preserving your fertility by freezing your eggs really affords you that extra bit of time and comfort knowing that you have actively done something to preserve your fertility as it is now. Now, what are the steps in order to get you to the point of being ready to preserve your fertility or freeze your eggs? Well, the first step is you have to get to know your numbers. And what we mean by that is, how many eggs do I really have? So what we know about our fertility, when we are born with all the eggs we will need throughout our reproductive life. And I want you to really think about within your ovary, we all have a savings account of eggs. Now, with time, what happens is that savings account, it goes down and it dwindles. And every month when we get our cycle, we pull out of that savings account a group of eggs. And I want you to think of that group of eggs as your checkings account. And out of that checkings account, we have one egg that grows, it ovulates, that becomes the egg that can be utilized for future pregnancy. And then those other eggs that have been pulled forward, those other eggs eventually end up dying off. So human reproduction, we know, is really inefficient in that way. So one of the good things about egg freezing is that what we do is we say, okay, those eggs that would normally die off, we give the patients medications that stimulate those eggs, and we grow those eggs, and we're able to extract them and use them for future utilization. So the first thing is, how many eggs do you have? How do you get to know this information? One of the ways you get to know this information is to get plugged into a fertility center where you can meet with your doctor. They perform what's called a vaginal ultrasound, where they're able to count all those little egg complexes called follicles on ultrasound to get an assessment, a numerical assessment of that checkings account that I mentioned. The other way too is through blood work testing. So there are key hormonal tests that we look at that give us an indication of your egg supply or your egg count. So those are really important markers that we utilize in order to say and address whether you are a good candidate to move forward with egg freezing, and also to be able to predict what the yield of eggs will be as you proceed with future egg freezing. So first, get to know what your numbers are. Now, once as a fertility specialist, we understand where patients stands in terms of their fertility numbers, their hormonal markers, their follicle count numbers, then they can proceed with the treatment phase. And starting treatment entails anywhere from a 2 to 4 week process where patients are taking medications that are delivered through daily shots. The daily shots are given at a specific time by the patient herself, and the nursing staff will train the patients accordingly in terms of how to self-administer these injections. Most patients will need to be on these daily shots or injections for about 10 to 12 days. And during that 10 to 12 day time frame, the patient is coming into the fertility office on average every 2 to 3 days to have an assessment of how the body is responding to these daily shots. The assessment of how the body responds is done through a vaginal ultrasound to evaluate the size of those egg complexes called follicles, and also through blood work assessment, where we track hormone levels that we expect or anticipate to rise as the patient proceeds with the medication regimen. So during the completion of this 10 to 12 day time frame of medications, once we know the follicle sizes have reached what we call a mature size where they're ready to be extracted, the patient then gets prepared for the next phase, which is actually the egg harvesting phase. Now, the egg harvesting phase is actually a minor surgical procedure that is done under IV sedation. So that means you are asleep, you are not aware of what's happening, you are comfortable, and using a vaginal ultrasound apparatus that is connected to a specialized needle device, the needle is able to enter through the vaginal wall into the pelvis and then into that follicle, that little egg complex, and suction out the individual eggs that reside in the ovary. Now, the egg harvesting procedure is a relatively short procedure. On average, it can be anywhere from 10 to 15 minutes of time. And then at the completion of the procedure, the laboratory will give us a total count of how many eggs have been obtained at the time of the egg harvesting. Now, what's really important for patients to know, it's a minor surgical procedure. Most healthy patients do very, very well with the egg harvesting. And so really important to just be aware that sometimes surgery can be very anxiety producing or kind of stressful to think about, but it's a minor procedure and most patients do really well with it. Now, typically the next day after the egg harvesting, we get an assessment of how many mature eggs have been obtained. And at that time, the physician will contact the patient and let the patient know how many eggs have been obtained. Now, there are some circumstances where, depending on a patient's egg reserve or follicle count, that a patient may need more than one round of egg harvesting in order to reach a target number of eggs. So it's important to have that conversation with your doctor in advance about what to expect in terms of your egg yield. And then once you have an idea of how many eggs have been obtained, whether that number is a sufficient amount, whereby an additional procedure is not necessarily warranted. Okay. And then the other important thing is once the eggs are frozen, we know they are, essentially frozen indefinitely. Now, we do counsel patients optimally that we would like for them to be able to utilize their frozen eggs in the future at a time whereby they are still within what we call reproductive window, meaning they're still young enough so that way some of the consequences and complications that come with advanced maternal age and pregnancy will not be as impactful. And also, too, in the event that those previously frozen eggs do not yield a positive outcome, they still have an opportunity, to try again for future pregnancy. So it's really important to keep that in mind. Those eggs are frozen indefinitely, but the goal is still to pursue pregnancy when you're within that reproductive window. So another important component of the egg freezing process is that it can be costly. So we know on average, the cost of this whole process of getting to know your numbers and then starting medication treatment and then going through the egg harvesting and then storing those eggs frozen, like that whole process can be costly on average about $15,000 for many patients. Now, there can be some price differences from center to center. So it's important to be able to have a conversation with the fertility center that you're utilizing about truly what the costs entail. And also, have a conversation too about whether or not you have any degree of insurance coverage for this process. So what we know is that more and more employers now are offering egg freezing as a benefit. So please make sure to contact your HR department and ask if egg freezing is a covered benefit under your plan. It's also important for patients to know that many states now, they do have mandated insurance coverage for egg freezing for patients with a new cancer diagnosis that may require chemotherapy or who have a medical condition that may require medications or surgery that will directly impact their fertility. So it's important to know that there are certain programs in place that will automatically cover egg freezing. But again, these are conversations that you should have with your medical team. Now, lastly, when the eggs are stored, many centers will have an annual storage fee that is independent of the cost or separate from the overall cost that the egg freezing process entails. So just be aware that typically that annual storage fee ends up being a few $100s. For many patients, that investment is worthwhile for them as they proceed to be intentional about their fertility and planning. Now, when it's time for you to use those frozen eggs, the next step of the process is truly what we call in vitro fertilization, or IVF. What that means is when you are ready to utilize those previously frozen eggs, those eggs in the laboratory will have to be thawed. And then upon being thawed, they will be fertilized with sperm of your partner or a donor sperm. And then, so that is the in vitro part. And then once fertilized, that now embryo grows in the lab and develops until it reaches a critical developmental stage around days 5 to 6 of development. And it's at that point in time that the embryo can be selected to then be transferred or placed into your uterus. So that is the IVF part. So just know that once you have previously frozen eggs, when you are ready to utilize those eggs, you will need to undergo IVF. So this is just a very brief synopsis of the egg freezing process, what it is, what it entails, some nuts and bolts about the process and cost, and when you're ready to use those eggs, what those steps involve. So I'm open to any questions. I'm happy to hear any questions or concerns that you might have out there. And thank you so much for your time.
Absolutely. Thank you so much. Thank you. Thank you so much, Dr. Marsha. Is there anything else you would like to share with our audience before we end for this evening?
Well, again, thank you for having me on. I'm so glad we're able to have this conversation. It makes me so happy and energized to know that women are talking about our bodies, our health, our fertility. And so my best advice to everyone who's listening, again, be intentional about all things related to your health, especially about fertility. And it is such a timely issue in so many ways. So start those conversations with your general doctor, and we'll be happy to see you on the fertility side when you're ready.
All right. Thank you so much for being on here. And you know what? You know how to get in touch with us. I'm Dr. Kelly OMD at Dr. Kelly OMD on Instagram, as well as Vivalife Health Hub on Instagram and Facebook. I hope you all have a wonderful evening, and don't forget to do what? Viva Life. All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.